Good evening, and today's video is on hepatitis C. Let's begin. Hepatitis C is a viral infection that causes liver swelling, also called inflammation. It can lead to serious liver damage, and hepatitis C spreads through contact with blood that has the virus within it. Newer antiviral medicines are the treatment of choice for most people with the ongoing called chronic hepatitis C infection. These medicines can often cure chronic hepatitis C. Many people with hepatitis C don't know they have it. That's mainly because symptoms can take decades to appear. So that's why it's recommended that people from the age of 18 to 79 are to be screened for hepatitis C. Screening is for everyone, even though they don't have symptoms or known liver disease. Here are a list of symptoms for which hepatitis C occurs. Every long-term hepatitis C infection starts with what's known as an acute phase. Acute hepatitis C isn't usually diagnosed because it rarely causes symptoms. When there are symptoms in this phase, these include jaundice, fatigue, nausea, fever, and muscle aches. Long-term infection of hepatitis C virus is called chronic hepatitis C. This usually has no symptoms for many years. Symptoms appear only after the virus damages the liver enough to cause them. Symptoms can include as the ones described below: bleeding easily, bruising easily, fatigue and not wanting to eat, yellow of the skin, also known as jaundice, dark coloured urine, itchy skin, swelling of the legs, weight loss, and spiral-like blood vessels in the skin, also known as spiral angiomas. So, acute hepatitis C infection doesn't always become chronic. Some people clear the infection from their bodies after the acute phase. This is called spontaneous viral clearance. Antiviral therapy also helps clear acute hepatitis C. Screening for people aged 18 to 79 is very important, especially for people of high risk of exposure. So this includes people who have ever injected, snorted, or inhaled an illegal drug. Anyone who has atypical liver test results in which the cause wasn't found, and babies born from someone with hepatitis C. Pregnant people during pregnancy, healthcare and emergency workers who have been in contact with blood or been stuck by a needle, and people with haemophilia who were treated with clotting factors, and people who have long-term hemodialysis. People who have also got donated blood or organ transplants, and sexual partners of anyone diagnosed with hepatitis C. So, also other people include men who have sex with men, sexually active people about to start taking medicine to prevent HIV, well, pre-exposure prophylaxis, and anyone who has been in prison. So these are the people that are at risk of hepatitis C and need screening. So it's caused by the hepatitis C virus. The infection spreads when blood that has the virus enters the bloodstream of a person who isn't infected. It exists in various forms called genotypes. So there are 7 genotypes, 67 subtypes. With regards to chronic hepatitis C, this follows the same course no matter what the genotype of the infecting virus is. Treatment can vary depending on the viral genotype. However, newer antiviral drugs can treat many genotypes. Here on the left-hand side, you can see a healthy liver which shows no sign of scarring. When cirrhosis at the right, you can see scar tissue replaces the healthy tissue. So here on the other right-hand side, you can see liver cancer begins in the liver cells. So the most common type of liver cancer starts in the hepatocytes, and it's called hepatocellular carcinoma. So hepatitis C infection that continues over many years can cause serious complications, such as a process called cirrhosis, which is scarring of the liver. So scarring can occur after decades of hepatitis C infection, and liver scarring makes it harder for the liver to work. You can have liver cancer. A small number of people with hepatitis C infection get liver cancer and liver failure. A lot of scarring in the liver to stop working. Prevention of hepatitis C: stop using illegal drugs, be careful with body piercing, tattooing, and practice safer sex. So for piercing or tattooing, look for a shop that's known to be clean. Ask questions about how the equipment is clean. Make sure the employee uses sterile needles, and if employees won't answer the questions, look for another shop. You don't want hepatitis C after all. For practicing safer sex, don't have sex with protection of any partner whose health status you don't know. Don't have sex with more than one partner. The risk of couples who only have sex with each other getting hepatitis C through sex is low. And also stop using illegal drugs. I think that's a tip for everyone these days. Screening test shows hepatitis C. Other blood tests can measure the quantity of the hepatitis C virus in the blood, called a viral load. It can show the genotype of the virus. There's also techniques known as magnetic resonance elastography. So this non-invasive imaging can be done instead of a liver biopsy. It mixes magnetic resonance imaging technology with patterns formed by sound waves bouncing off the liver. This makes a map that shows places where the liver is stiff. Stiff liver tissue means scarring of the liver, called fibrosis. Then you have transient elastography. So another test of liver stiffness is a type of ultrasound that sends vibrations into the liver. The test measures how fast the vibrations go through the liver tissue. Then you have liver biopsy. So this is often done using an ultrasound as a guide. It involves putting a thin needle into the liver to remove a small sample of liver tissue to be tested in a lab. There's also blood tests. A series of blood tests can show the amount of scarring in the liver. Medicines are hepatitis C, so we have antiviral medicines. So they're used to clear the virus from the body. The goal of the treatment is to have no hepatitis C virus found in the body for at least 12 weeks after treatment ends. Some newer antiviral medicines called direct acting have better outcomes, fewer side effects, and shorter treatment times. Treatment can be as short as 8 weeks. The choices of medicine and length of treatment depend on the hepatitis C genotype, whether the liver is damaged, other medical conditions, and earlier treatments. Throughout treatment, a care team watches the treatment for response to side medicines and side effects. Treatment with direct antiviral acting medicines usually lasts 12 weeks. Treatments are changing quickly these days, so it's best to discuss this with a specialist doctor. Liver transplantation. So having a liver transplant can be an option for serious liver damage from chronic hepatitis C infection. During a liver transplant, a surgeon removes the damaged liver and replaces it with a healthy liver. Most transplanted livers come from dead donors. A small number come from living donors who donate a part of their livers. In most cases, a liver transplant alone doesn't cure hepatitis C. The infection is likely to return. This means more treatment of antiviral medicines to prevent damage to a new liver. So several studies have shown that newer antiviral medicines can cure hepatitis C after a transplant. However, the newer antivirals can cure hepatitis C before liver transplant. Then you have vaccinations. There's no vaccine for hepatitis C, but a healthcare provider will recommend vaccines against hepatitis A and B viruses. These are viruses that can also cause liver damage and make hepatitis C worse. So that's the end of today's video. So thank you very much for listening, and I hope you've enjoyed.